Without a healthy gut, it's really hard to have healthy skin. Your digestive tract is like the soil, and your skin is like the plant. If the soil isn't in good shape, the plant is not going to bloom properly. I'm Dr. Robynne Chutkan, gastroenterologist, microbiome expert, and author, and I am here to help you find gut bliss. On today's show, when a patient walks into my office, their skin is the first thing I see. Before I examine their abdomen or do a rectal exam or take a look at their colon, before I do any of that, the first thing that I notice is their skin. And what I have found in my almost 30 years as a gastroenterologist is that what is going on in your gut almost always shows up on your skin. Just like how an ophthalmologist can diagnose high blood pressure or diabetes or even some types of cancer when they examine your eyes, I can tell a lot about your gut health by examining your skin. And sometimes when I'm all up in someone's skin, I'm checking out their rosacea or their acne, they're like, aren't you supposed to be a butt doctor? Why are you so focused on my skin? And yes, it's true. I am a frustrated dermatologist, but my interest stems from this profound connection between the two organs. In this intro episode, I'm going to go over the connection between what's happening in your gut and what's going on your skin. And that's going to provide a background for us to build on when we get into the specifics of acne, eczema, rosacea, and psoriasis in the upcoming episodes. Like your gut, your skin is also a digestive organ. In fact, your skin is your body's second largest digestive organ with a surface area of about 300 square feet. Your gut is bigger at about 4,000 square feet. But like your gut, your skin also absorbs things. It also secretes things like water, salt, and oils, and it also excretes waste matter like urea, ammonia, and heavy metals. Think about when you put on makeup or lotion. I know that when I come out of the shower, I slather my skin with oil because I tend to be very dry. And a few hours later, it is nowhere to be found. It has been absorbed into my body through my skin. It has literally been eaten by my skin. But in order for something to be absorbed by your skin, it has to pass through a physical barrier. That barrier consists of an epithelial lining made up of squamous cells. And on top of that physical barrier, your skin also has a chemical barrier of lipids, fatty molecules that help to reinforce the physical barrier. That fatty layer helps to prevent water from evaporating through your skin, and it keeps your skin nice and lubricated. But even more importantly, the lipid barrier helps to prevent pathogens from getting inside your body through your skin. Let me give you an example. The lipids on your skin repel Staph aureus, the bacteria responsible for lots of different skin infections. Staph aureus lives harmlessly on many people's skin, but it causes an infection if it gets into the skin, or really into the body, through a cut or some other breach in the physical and chemical barrier. So one of the most important functions of your skin is this barrier function to keep things outside of your body. The Gut Bliss podcast is brought to you by VisBiome, my first and quite frankly, my only choice for a probiotic. Whether you're dealing with irritable bowel syndrome or just looking to restore your gut health, VisBiome can help. It's a medical food for the dietary management of IBS and gut inflammation, backed by science and clinically vetted by thousands of my own patients. Find your gut bliss with VisBiome. Go to visbiome.com/gutbliss and use discount code GUTBLISS at checkout. Your gut also has a physical and chemical barrier. Your gut lining is made up of intestinal epithelial cells, and some of those cells secrete mucus, which, just like the lipid layer in your skin, helps to keep things in your gut moist and lubricated so that the products of digestion can move through easily. That mucus layer also traps and repels invading pathogens. In fact, the mucus layer in your gut is one of the most important defenses against viruses like SARS-CoV-2 and poliovirus. In your gut, there's also a third layer of protection, and that's the trillions of microbes that live in your digestive tract, known as your gut microbiome. I want to point out something that is probably obvious to you, but honestly, I had been a doctor for over a decade before I really thought about this. When you eat something, it is not actually in your body. It's in this 30-foot-long hollow tunnel that runs from your mouth to your anus, known as your digestive tract. In order for nutrients and other substances to get from your gut into your body, they have to pass through your multitude of microbes, they have to pass through the mucus layer, and they have to pass through the physical barrier of your intestinal epithelial cells. And then, and only then, are they actually inside your body. Like your skin, the lining of your gut is in constant contact with your environment because it's exposed to everything that you ingest. So all the food you ingest, toxins in the food, pollen that you swallow, it's all coming into contact with your gut lining. And one of the main functions of the gut lining is to maintain a highly selective barrier for entry. We ingest toxins and viruses all the time that our GI tract keeps outside of our body by never allowing them to penetrate the gut microbiome, the mucus layer, and the gut lining. So think of the inside of your body as an exclusive club that people are trying to get into. There's a bouncer at the door, and they check you up and down and decide whether or not they're going to let you in. And this is a very selective club. Poorly digested food particles? Sorry, you can't come in. Undesirable viruses? Your name is not on the guest list. Toxins in food? Nope, not letting you in. And who is that bouncer at the door that is keeping the vibe inside your body healthy and safe and keeping out the undesirables? It's your microbes. It's those trillions of microorganisms that live in and on your body, mostly in your gut. They're the ones who help to maintain the selectivity of that barrier by interacting with immune cells on the other side of the lining. So the immune cells are inside your body. They're in the club. And they're like the security guards in the club, where if there's some bad players who are making a ruckus and who maybe now need to be evicted, or some bad players on the outside who are trying to bust in, the bouncer, also known as your gut microbes, calls in security, also known as your immune system, to handle the situation. So it's a hand-in-glove relationship between your microbes on one side of the gut lining and your immune cells on the other. Just like the bouncers outside the club and the security guards inside the club work closely together to maintain a safe environment in the club. At least I think that's how it still works at the club. It's actually been a while since I've been to one. Now, here's what I want you to know about how what's happening in your gut can create a problem for your skin. If that gut barrier is breached, then a substance that you might otherwise never react to can now cause a reaction because now it's getting inside your body and it's triggering an immune response. I want you to imagine a scenario where you've taken antibiotics for a respiratory tract infection. So now your gut microbiome is compromised because the antibiotics you just took have killed off a lot of your healthy gut bacteria. And you're also taking ibuprofen because you're feeling kind of achy from this infection that you have. So now your gut lining is compromised because NSAIDs like ibuprofen increase the permeability of your epithelial barrier by literally poking holes in your gut lining. The cold and flu medicine you're taking also contains a decongestant to help dry up your mucus secretions. So now your mucus layer is also thinned out and compromised. You're feeling kind of sorry for yourself because you have this terrible cold and you don't feel like cooking. So you decide to heat up some frozen pizza and you're going to have some ice cream, some comfort food after to make yourself feel better. Unfortunately, ultra-processed foods like frozen pizza and ice cream are full of preservatives and emulsifiers. Those chemicals now have an open door to enter your body through that compromised microbial layer from the antibiotics, the thinned out mucus layer from the decongestant, and the more permeable epithelial barrier from the NSAIDs, what we commonly refer to as leaky gut. A lot of the time, people think they're allergic to all of these different things. But often, it's not just the substance itself that's causing the allergic reaction. It's the fact that it's getting inside your body through your gut when it should normally be on the outside. That is a problem. A pediatric study took children with eczema and measured their intestinal permeability and then put them on a strict elimination diet. In about 2 weeks, several of the children had improvements in their intestinal permeability. But the ones that had the most gut improvement also had the most improvement in their eczema. So from a therapeutic point of view, it's really important to consider what is going on with your gut if you're trying to heal something on your skin, because translocation of substances through your gut lining can allow those substances to enter your bloodstream and trigger an immune response in another organ like your skin. A lot of skin problems like rosacea and eczema and psoriasis are systemic, meaning they're a manifestation of something going on elsewhere in your body. And that elsewhere is frequently in your gut. Let me give you some examples of how that works. Rosacea is a type of autoimmune disease that has been linked to inflammation and bacterial imbalance in the gut, a condition that we refer to as dysbiosis, a sort of messed up microbiome. SIBO, small intestinal bacterial overgrowth, is a form of dysbiosis, and SIBO is 10 times more common in people with rosacea. Rosacea is one of the most common symptoms I see in my bloated patients with a disrupted gut microbiome. And again, what I notice most dramatically is that when those patients' gut inflammation clears up, their rosacea also clears up. About 10 to 20% of people with celiac disease, another autoimmune disease, have a rash called dermatitis herpetiformis. And that rash responds dramatically to a gluten-free diet. So as the changes in their gut from the celiac disease normalize when they remove gluten, their dermatitis herpetiformis also clears up. Crohn's disease and ulcerative colitis are also autoimmune diseases that affect the gut, but they can also cause ulcers and nodules on the skin, two conditions called pyoderma gangrenosum, that's the one that causes ulcers, and erythema nodosum, that's the one that causes nodules. And treating the inflammation in the gut in patients with Crohn's and ulcerative colitis also clears up the skin lesions. So there is a direct relationship between the inflammation in the gut and the inflammation on the skin in these patients. And what's even more interesting is that the skin lesions tend to erupt when the gut disease is active. I've had patients with Crohn's disease who develop these big red nodules on their arms and on their legs, the erythema nodosum, and the nodules are very painful. But as we get their gut symptoms into remission, their skin lesions just melt away. Literally, the erythema nodosum goes away when the GI symptoms go into remission. Skin problems and some of these inflammatory gut conditions can also be caused by the medications we are using to treat the gut inflammation, especially drugs like steroids and antibiotics. Now, antibiotics are a common treatment for things like acne and rosacea, but they're a short-sighted fix because in the long run, they can lead to overgrowth of pathogenic bacteria and decreased numbers of the essential good bacteria in the gut. And this microbial imbalance in the gut is also going to show up on the skin and on the scalp where it can profoundly affect your appearance. So in the next couple of episodes, as I go over each of these skin conditions, I'm also going to give you some important alternative treatment options that can heal both your gut and your skin. I want to leave you with 3 takeaways about this gut-skin connection. Number 1, a compromised gut lining can lead to an immune response that shows up on your skin. So you have to pay close attention to that physical barrier in your digestive tract. Number 2, a disrupted gut microbiome is also strongly associated with skin conditions like eczema, rosacea, acne, and psoriasis. So optimizing the bacteria in your gut is critical for healing your skin if you are suffering from one of these conditions. And number 3, both your gut and your skin are digestive organs that absorb, secrete, and excrete. So you need to pay close attention to what you are feeding them. So that's it for this edition of the Gut Bliss podcast on an introduction to the gut-skin connection. Coming up next week, I'm going to tell you precisely what ingredients to stay away from and which ones you should be ingesting every day to heal your skin from the inside out. And I'm referring to both personal care products that you put on your body as well as the actual food that you put in your body. Go to gutbliss.com for my free 7-day microbiome reboot course. If you like what you're hearing, drop a review and hit that subscribe button. And remember, dirt, sweat, vegetables, the best prescription for a healthy gut.
The information presented in this show is not meant to be medical advice. Consult your doctor before making any decisions about your health. The patients discussed are real people, but names and identifying features have been changed to protect their privacy.